Hi, good evening, everyone. I'm Brijraj, co-founder, CEO at SPRY. Thank you, SAS Bhumi, for giving us an opportunity to talk and speak about our story. So I'll talk about how we built SPRY, which is a digital health company from India for the US, right? Just wanted to take the first few slides, talk about the context of what we do and how, because everything the playbook depends on the context. Like there's no one playbook to do things. What business are you doing? What markets are you targeting? Will decide the playbook that you go after. So what does SPRY do, right? SPRY is, in simple words, the operating system of records, system of action for the physical rehab clinic in the US. Right from the time the patient walks in the door, till the time the patient walks out and you get the money from insurance, which is a few weeks down, the entire workflow, the entire process of that patient is managed on SPRY. I think there are lots of numbers here, but the two most important numbers to understand the depth of which SPRY does work is, we process $140 million worth of claim every year. At this time, that's the run rate. But more importantly, for all those 500 clinics which are live on SPRY, 100% of the cash flow flows through SPRY. So it's a platform which has a lot of responsibility. If something goes wrong with us, the cash flow stops. These are small and medium-sized clinics. They don't have a very strong balance sheet. They're not funded by VCs, right? They thrive off cash flow. If the cash flow stops, they can't make payroll, they can't treat patients, and everything goes downhill. So that's the responsibility we own. Second is, people spend 7 to 8 hours on SPRY every day because whatever they do with the patient has to be documented, right? The joke within SPRY is that when we look at some of the metrics that we see, that people spend more time on SPRY than they spend with their spouses or their partners at home. But the thing is that you spend time with your partner or spouse by choice, or at least most people do. SPRY is not a choice, right? No one became a therapist to write notes. Similarly, I did not become a developer in my early days of my career to update Jira, nor am I a salesperson now to update Salesforce. But this is a necessary evil of their job. I can still get paid if I don't update Jira, if I write my code, or I can not update Salesforce and meet my quota. But a therapist or a provider does not get paid unless they update the notes and those notes make it to the insurance company. So it's a necessary part of the evil. So while they spend a lot of time with us, the tolerance for nonsense is very, very low, right? You might expect, they don't want annoyance because this is not what they want to do. This is not what they took student loan for. This is not why they work 7-8 hours from the clinic instead of working from home. So they want minimal disruption in their daily workflow. And that's the responsibility SPRY has. So on the business side, we have to ensure that we can manage the entire cash flow. There's no disruption in that. And on the day-to-day operation side, zero disruption, right? Things should work. Things should just work. That's the promise that SPRY has. So how did we come out doing what we're doing right now, right? Why could we also build a SaaS tool which sits on top of Salesforce, which sits on top of Shopify, and just go from there? Because we wanted to modernize healthcare. When we started doing this, I came from outside. I was a CTO at Ola Cabs before this. I had a B2C company which got acquired by Ola. So I had no context of healthcare. So I took the opportunity to actually study this ground up, like how things are, what's the lay of the land, etc., and went without any bias of what I wanted to build. What we saw was that a clinic owner who's running a small clinic with 3 or 4 providers, seeing 30, 40 patients a day, is juggling with 4 or 5 different tools, not talking to each other. Right? And he's not smart enough to have a Zapier and get them to talk to each other, right? So he's doing the juggling work. They don't even have visibility into how and when will they get paid. Right? That's what it is. None of these systems which operate in healthcare, I think which is very specific to healthcare, are open. They're mostly closed systems. Data is siloed. So it's not easy to build something on top of it. And getting them to, and whichever systems are open, you might hear of Epic and Cerner and all that. They're nothing but closed walled gardens, right? So nothing is truly open in healthcare, any country for that matter. So while it's easy to say that build on top of something, it's difficult to pull that off. So we thought we will actually rebuild the engine. Now that's a difficult SaaS endeavor. People don't like to change stuff. People don't like to rip and replace stuff. But we took the bet that we will replace everything ground up because the foundation is fundamentally broken. And we decided to do that from India, because a lot of talent that is needed to understand the business, that was needed to build this out, was available in India. For example, there are, I think, around 2 to 3 million people in India who have been doing revenue cycle management, credentialing for hospitals and providers in India. while they were doing a lot of work as a services company, they had a lot of inherent knowledge about how things work, and you had to just understand tap into the knowledge and productize it. That's part one. Second is, what's my job as someone who's working for the provider? I had to figure out a system which helps beat the insurance company. The payer wants to be paid by the provider. So I have to just figure out what are the rules on the other side of the game and figure out a way to beat them. Now the people who write the rules of the game are also sitting in Pune and Bangalore, working for the captive of those insurance companies. So we tapped onto that talent. And the third one was, how do we know the domain knowledge, how physical therapy works, how mental health works? We saw two cohorts of people. One, people who had worked there and gone there and had come back to India. So they had a soft landing on working with SPRY, explaining as to how things work. And then people like institutes like Manipal, who send a lot of people abroad, either as a placement service or something like that. That alumni network turned out to be a resource for us, which we could tap onto to understand how healthcare works. So we put all of that together, combine that with a tech skill. We were able to build a platform from India for the most part, for the US, in a much more effective manner, in a much more comprehensive manner that we did. So, how did we incorporate AI, right? I think, today I think when we talk about AI, Gen AI, everything is AI. Simple if statement is AI, simple automation is AI, regression is AI, right? But when you implement it in life and when you want to sell it, how do you think about AI? We were subconsciously doing this, but I did not have this framework. So this is a great framework, which I call the work versus toil framework. This is not my framework, this is all disclaimer. I just learned it from a guy called Jonathan. He is the head of product at Clio, which is a legal tech company. So what do you automate? What do you not automate, right? And where do you apply? Where do you not apply? Because everything cannot be AI, right? Okay, it's not. When you're building a vertical SaaS platform. So think about a person's work and think about what they do. Any work, for that matter, has two components of work. It's not people, when people say people hate their work, that doesn't mean they hate everything about their work, right? People also find purpose in work. But when people say they hate their work, they hate the toil which is behind the work. Well, I was saying, when I was a developer, I hated updating Jira. Now that was toil for me, right? Similarly, a therapist, when he sees a patient, calling up the insurance company, verifying the insurance is toil for them. Why should he or she have to do that? This is not what I paid medical fee school for. Similarly, for me, to get them to write the paperwork, what the medical history is, what the paperwork is toil. But treating a patient, telling them how they feel about their pain, how they feel about the exercises is not toil for me. That's part of work. That is why I became a physical therapist. That is how I became a mental health coach. So clearly differentiate in the entire workflow, what is work, what is toil. Right? So when we looked at our persona, what was toil for them? Scheduling patients. Why should I have to worry? Okay, the patient wants to come every Friday, 4 p.m. Why should I have to go to the calendar, find that slot and put an appointment? Why can't that be automated? Intake forms, getting a patient, it's compliant, it's a compliance requirement. Why should I have to get a patient? I should help, because most of these patients are old, 65, 70-year-old patients. They can't fill out a form themselves. As a therapist, I have to help them. Why should I have to work hard on doing that, right? That's all toil for me. And when you add up a lot of toil, your work becomes cumbersome. That's when you start hating your work. But if I had to only spend time treating patients, I had to use clinical judgment. Oh, this is the pain. This is how you had a fall. 2 years back, this is what happened. And if I have to use my brain doing that, that's part of work. That's part of why I became a therapist, right? Motivating patients, giving them treatments, seeing them recover. That's the pleasure that I get out of doing my job, right? Example, similar. Just if you're a developer, seeing your code deploying in production is part of the joy that you get, right? And deciding what to happen. So when people say that I want to automate everything, don't automate work to start with. Automate the toil. And when you're automating work, that's a very, very difficult sell. You are saying that an LLM, which is trained on Reddit data, can do my job better than me. That's nonsense, right? That's not going to happen anytime, at least in the near future. After 10 years later, maybe that happens. So figure out what the toil part of the job is, what the work part of the toil job is, automate the toil, and give co-pilots for the work. That's the framework that we developed when we figured out how to inculcate AI into the platform. Yeah. So these are examples of how SPRY uses AI and what is the difference in our AI versus what others do, right? So one of them is patient to payment agent. When a patient walks in, the patient scans his or her credit card on a kiosk. He doesn't have to enter it. OCR kicks in, takes the insurance information. In the background, wherever it has to go to a clearinghouse, it has to go to the insurance company website, or it has to even call the insurance company. All of that is done by an agent. Gets all the details, and gives it to the provider before the appointment. Right? The appointment is booked on the day prior. So before the patient walks in, all of that is automated and given to the doctor in front of him. Now imagine how it saves 10 to 15 minutes of their time, 15 minutes of their toil per patient, and you're seeing 10 patients a day. So essentially saving 100 minutes of toil, right? Imagine how important, how better your work becomes when you start doing that. Second is scribe. I'm talking to a patient, and then I have to go and make a note of that patient. That's double the work. I've already spoken to the patient, I've engaged with the patient, and I have to go and document all of that. Why should I need to do that? So we built Scribe, again, all in-house, so that when the conversation is happening, you're recording that conversation and marrying it to your current workflow. Again, Scribe doesn't run independent of your current workflow, it marries to the independent workflow. And every doctor has their own nuance, every therapist has their own nuance, right? So the thing that we built out here is you can give your custom prompt. So while we have the generic prompt, which does 90-95% of the work, because LLMs normally are generic in nature, you can write your own prompt, which is like your own model of yours, which will add those nuances which you need. For example, some people say, I like to say pain is digit 8 out of 9. Some people say, I like to say digit EIGHT out of 9, right? Something like that. So you can add your own nuances. I like to put palpation in this column, whereas I like to put palpation in another column. So you can add your own nuances within that. Similarly, when you're doing scheduling for a patient, you can say that schedule a patient only twice a week, not more than any patient more than twice a week. So you can tell the agent that. So you can give your own nuances on top of agents. So that's how SPRY was built, that you figure out pieces of the toil, automate them, but also give the personalization layer so that therapists love using it and they don't churn from it, right? So the nuances are captured. So I think this is what SPRY does. Set some context on what SPRY does, how important we are to the daily workflow, daily life cycle of a patient. So now how do you build a digital health playbook? So now I'll go to that, right? First, I think from my learning, healthcare is obviously huge, $4.5 trillion opportunity, bigger than the GDP of India. But just saying that's a $4.5 trillion opportunity is actually not the right way to look at it. That's like saying India is a consumer market of 1 billion people, right? 1.4 billion people. It never works that way. So in my experience, while it's a $4.5 trillion opportunity, it has to be looked at 1,004 billion dollar opportunities. That's how we started. The addressable TAM for SPRY in the early days. And we got a lot of pushback from the VCs that, okay, it's a very small TAM. But for a vertical SaaS company, small TAM is a feature, not a bug, right? So we were okay with that. And we started with a $4 billion industry. And then obviously, as I talk about it, you can expand without you even realizing it. So that's what I said. So divide your market. Now, we did a vertical solution. That doesn't mean everyone has to do a vertical solution. You can be a $4 billion opportunity at a horizontal layer also. Patient communications, Scribe itself. You can operate at a horizontal. But the idea is to identify that what is that one opportunity that you're going after, right? It can either be a verticalized opportunity or it can be horizontal. There are pros and cons of both, right? And it depends on what your skills are. In verticalized, you have to understand the business well. You have to redo the plumbing, which are the difficult parts of doing it, and the opportunity is obviously bigger. In a horizontal solution, in healthcare, you cannot operate in isolation. You have to figure out how will you integrate on top of existing systems. How will you integrate on top of existing layers? Without that, it's not going to be possible, right? So everyone knows, I don't know, many people know Brijraj. Brijraj got to fame because it was able to ride on Epic, which is one of the most dominant EMRs. So if you doesn't matter if you build the best solution for patient communication, but if you are not able to ride on an existing platform, not able to integrate with an existing workflow, your solution will not sell. So both have the pros and cons. You decide which one is your battle that you want to pick. Right. Now, obviously, you want to do everyone's on AI. When you go to sales pitch, everyone knows what is AI, where all are you using AI, how does AI save my life, is a common question that we get on all sales calls. Right. So how did we start? We started figuring out, obviously, where the toil was the highest, right? Because that is the work and the toil framework. The other is we built AI in a way that there was no questioning what AI is doing. So we always had a man in the middle and the two most things, right? So we took individual places of toil. So for a front desk, the toil was scheduling an appointment. For the therapist, the toil was writing a note. And for the biller, the person who bills out in the account department, the toil was actually checking out the eligibility. So we took one from each of these personas because I need all of them to be convinced to be able to buy SPRY. And then we automated that part of the section, right? And we focused on outcomes. When we went to the next sale, we didn't say, okay, we have AI doing this, we didn't AI doing this. The therapist started saying, I go home by 5 p.m. Earlier, I had to sit till 8 p.m. to complete my notes, right? The biller is saying that earlier, 70% of my claims, 30% of my claims needed a manual intervention. After SPRY and the AI kicks in, 95% of my claims are actually going through without me having to intervene in that. The front desk is saying that earlier when I had to do that, I was spending 15 minutes on scheduling a family of two with 2 kids because they had some weird credentialing requirements. So I could not spend time with the patients. I could not get data from the patients. And if I cannot get data from the patient, I cannot submit the claim to insurance. So if I don't spend time on the calendar and I spend time with the patient, I can actually do that. So focus on the outcomes rather than the features. Once you do that, I think it's important to make sure that your AI, the feature that you build or the workflows that you automated or the toils that you automated, integrate end to end, right? So our AI scribe, it's just an example of what you gave you, doesn't work in isolation of the workflow. So it's a pelvic floor workflow, it's a pediatric workflow, or it's a sports workflow. AI scribe actually marries to that. So it is a part of that. When I'm building AI agents for billing, I'm not building agents which will only work for a specific insurance, right? I have to build agents for worker comp, I have to build agents for motor vehicle accident, I have to build agents so separate for them. But it should be integrated into a workflow. And then you start seeing the magic happen. Similarly, scheduling. So the scheduling part of the platform should start talking to the therapist part of the platform. The therapist part of the platform should start talking to the billing part of the platform, and all of them are working in symphony. That's when magic starts happening on the platform. And then magic started happening, right? Most of the clinics which go live on SPRY, and it's documented, start seeing a 20-30% increase in revenue within the first few months itself, despite drop in reimbursement, despite insurance paying you less money. And that's happening because all of them are talking to each other, and there's a symphony happening between all of them, right? You're spending less time, you're spending less effort, you're spending more time with patients, you're spending less time on the administrative work, and getting this higher revenue, which is another bill. So focus on these things is how was Act 3 for us. And last, healthcare specifically, people talk. It might seem like a $4.5 trillion industry from here, but essentially it's controlled by 10 to 15,000 people that we know out there. All of them talk. Each of them have their Reddit groups. Each of them have their Facebook groups. If you mess up, it will be all over the place. If you do well, it will take time to propagate. Every time, even today, a prospect comes to SPRY, he or she is evaluating 7 to 8 pieces of different software. This is a mission-critical software. Impacts each and every part. As I said, you spend more time with the software than with your spouse, right? So expect people to see a lot of these softwares, right? And if you don't have the necessary trust, there'll be few, obviously you'll make those few sales here and there, but for your sales to scale, trust has to be there. So while building features, while doing the sales, we've been also focusing on establishing more and more trust. So one of the things that we did was got our ONC certification. That's a healthcare body which says that SPRY is safe, SPRY can interoperate, it's more futuristic. So now we're investing in SOC 2, then we'll invest in a lot more, right? So keep on investing in certifications, keep getting the stories out, right? And another thing we did, when you do AI, one of the things is people don't know what's happening in the background, and that's where anxiety increases. So we have a dashboard which tells you what all the automation was and what is the status of the automation, right? For example, we verify the insurance eligibility of the patient. Now, how do I know if SPRY told me it's $20, how do I know it's actually $20? So we have a dashboard which says that, okay, we told you $20, and when the insurance paid you, what was the amount? Is it 20, 25, 30? So we have a dashboard which says that. So we put our neck on the line because they can always come back to us, right? You told me this. The whole healthcare operating system worked on black box, ambiguity, etc. So we've taken that ambiguity away, which obviously puts a lot of strain on you in the early days of your business. But then if you can solve those problems, then actually increases trust. Right, so those are things. So we build dashboards which tell people how much we have QBRs. In QBRs, we don't discuss issues. We talk about what our AI achieved for them. Okay, authorization rate is 95%, it's 97%, right? We discuss these things, we discuss success metrics, and we also take targets for the next one. And okay, now we'll reduce a cancellation by 5%, right? That's a target we play, and we go after that. So that's another reason. So we increase trust, and yeah, I think 3 years back on G2, we were not a ranked platform. Now within physical therapy, we are the number 2 or the number 3 ranked platform within physical therapy, right? That's what we've made it happen because of that. And I think India has been great for us. We continue to build out of India. Our competitor uses this. If you ask my competitor, my biggest ones, how do you win against SPRY? The only answer there is onshore versus offshore. We have been able to build the necessary talent here. Obviously, my background in Ola helps be able to have that, but we have amazing engineers here. We have a billing team, people who worked on different specialties, be it pain management, be in hospital, done a lot more complex work than we do, understand them doing it. We are doing all our onboarding and support from here, right? Our billers, who are supposed to support them have become consultants, because when a clinic comes live, they have a lot of AR, outstanding receivables. Our billers are now going into the existing system, understanding where their problems are and helping them figuring out how this. So from becoming a service arm, we've also become a consulting arm, and it's all from India, right? And we continue to scale that operation. So it's been a great advantage for us. I think just summarizing, I think it's 11 seconds away. I'm almost there. What we've learned: solve real pain, not vanity. AI, especially for a verticalized solution. Pick small markets. We picked physical therapy, which is not very glamorous, not very sexy at that point of time, but now it's getting more and more. Toil, obviously, I'm a big fan of the Toil and work framework. And what you realize, once you start doing these things, it takes longer to get there. Your TAM expands exponentially. Today, the TAM that we have. So today, I also didn't realize, we are doing almost $1 million worth of same work in mental health. Even I didn't know that, right? We are doing pediatric care. I didn't even know that acupuncturists and massage therapists get reimbursed in the US, and we are catering to them as well, right? And then we get requirements from a bunch of other places. So if you do these things right, and then you can figure out there are so many adjacencies within healthcare that you can expand your TAM exponentially, right? Today, TAM is no longer a problem for us. Which TAM? Now the problem for us is, where do I want to play and where I don't want to play? So from being at a place where a TAM is very small. So I think, but it takes time in the early days, especially if you're not from the industry. We took a little longer than others because we were not from the physical rehab space or the healthcare space. But if you're already there, that's an added advantage. But don't worry about them. Look at all the successful companies, forget SPRY, Toast, I think Service Titan, all of them started with a small TAM. But once you do those small things right, this playbook right, the TAM will expand exponentially and you will have a lot bigger opportunity to play with, right? So Toast, I'm taking some advice from the CRO of Toast. It took a long time to get to 40 million, I think for 5-6 years, but then went from 40 million to 1.2 billion in a matter of 3-4 years. But 1.2 billion to 2.1 billion has been a matter of 1 year for them. So their time just expands, right? I think those are some of the lessons you can learn. And if you look at the revenue playbook, revenue cover for all of these vertical SaaS companies. Cool, my time's up and I'm also done. Thank you.
First of all, my name is Ram, and I'm from Bay Area. I really loved your session because I work as a corporate development guy, and I have a lot of investors in medical space who trust me. This is very hard industry to penetrate. I've seen your Epic and things. This is super, super hard. So first of all, great job.
Thank you.
And I would like to connect you with one of our portfolio doctors who does urology with 40 providers. Let's reach out, and I would be happy to connect. That's number second. Third thing is, my question is, how do you tackle the AI accuracy? When you transcribe, the doctors are all over and things.
Yeah.
And do you get a nice voice, or do you have an external Bluetooth mic, or do a humans transcribe after the machine transcribes? So how do you sort that one out?
Yeah, so the typical workflow in physical, so again, I think you have to be in a physical therapy clinic to do that, right? And it's a far more acute problem. It's a small setup like this. There are 3-4 beds, and there are people treating, and everyone's talking, right? The most common form is using the AirPod or the mobile app. So we can't expect them to be on the laptop. So we have a companion mobile app as well for people who don't. In fact, I was wearing my Meta glasses just before this session. We are trying to experiment if the Meta glasses can be used. But the idea is we've added noise cancellation. So a lot of work has to be done on the front end to be able to do the noise cancellation. But the key part for us is we already have some context about how this therapist wants to treat the patient, right? So we have something called as a workflow. So when they onboard with us, we take around 6 weeks to onboard any clinic. So at the time of onboarding, we understand what their preferred workflow is. You ask for pain, you ask for palpation, right? So we have some context on what the mental model is going to be. So when the text comes in, and physical therapy is actually weird, right? Because people talk about everything under the sun, from relationships to problem solving. So we have to figure out how to filter it. But if whatever they talk has to be filtered through my workflow and fit into the workflow, I think that's the way we actually do that, right? And obviously we worked on some noise cancellation stuff on the front end side to do that. But the most common workflow is you turn on the patient chart, put your AirPods on, go start treating the patient and talk to the patient at that time. That's the most common workflow that we've seen right now. Yeah.
Cool. Thank you.